Hi, Mr. Davis. I'm
Hello.
student Dr. Doxey. How are you?
Good, how are you?
Good. So what can I help you with today?
Oh, I came in because I've had some pain in my left foot over the last, well, I've had it kind of on and off, but I just wanted to see what was wrong with it.
Okay, all right. Well, let's take these shoes off and see what we're working with here. Is that all right?
Yes, that's awesome. You can just slip them right off there.
All right.
Thank you.
And your socks too. So you said it was this foot.
Yes.
Okay. And do you remember anything that happened or?
No, there was no event. It's been achy for the last like 2 years, and recently I got a new job, so I've been on my feet more, and it's been just more frequent and more painful.
Okay. Could you show me where it hurts exactly?
Yeah, it's kind of on the bottom of my foot, like right here.
Okay. And it's achy, you said.
Mm-hmm.
And is there anything that makes it feel better or anything that makes it feel worse?
Yeah, just getting off my feet at the end of the day. The more I'm on it.
So rest makes
Yes.
it feel better?
Yes.
And after you've worked a lot or been up all day, does it hurt worse?
Yeah, it does. It gets worse, progressively worse as the day goes on. And during my lunch break, it's awesome. I get to put my feet up and it stops hurting.
Okay. And if you were to rate it, at 1 out of 10, how severe is this pain?
Oh, at its worst, it's probably a 5. It's not too bad, but it's enough that I'll take like ibuprofen so it doesn't hurt.
Okay, awesome. Well, I've got a couple questions for you that are going to help me to get your history and be able to treat you. And so try to answer these questions to the best of your ability.
Okay.
Have you ever been hospitalized or had surgery?
I did. I had a hernia when I was 12, so I had to have surgery when I was 12.
Okay, but you haven't had anything else?
No other surgery.
Okay. Any other major childhood illnesses or adult illnesses?
No, I don't have any illnesses.
Okay. What about immunizations?
I believe I'm up to date. Your nurse said I was anyways.
Okay, awesome.
Yeah.
Awesome. And are you on any meds?
Yeah, I take omeprazole for heartburn.
Okay, all right. And what's the dose for that?
I'm not sure. I can get back to you later about that.
Okay, awesome. And are you allergic to anything?
No.
Okay, not allergic to any drugs or there's no food allergies or anything?
No, I don't believe so.
Okay, awesome. And have you ever had a blood transfusion?
No.
Okay, and would you consider yourself generally a happy person and in a good emotional state?
Yeah, if I'm not at work. No, I feel good most of the time. Pretty happy guy.
Awesome,
Yeah.
awesome. All right, well, let's talk more about some of your lifestyle things. Do you get enough sleep at night?
Yeah, I try to get that 8 hours. Usually get it.
Okay,
Yeah.
good. Do you smoke?
No.
Have you ever smoked?
No.
Okay. Are you sexually active?
Yes.
Okay.
Yes.
Do you have sex with multiple partners?
No, I'm married to my wife.
Okay, awesome.
Yep.
And are you what do you do for your job?
So I'm a medical student, so I'm in school right now.
Okay, awesome. And
Yeah.
do you exercise?
I do, probably once a week
Okay.
at best.
all right. Me too. That's something that you got to work on, but it's good that you're at least getting out there once a week.
Yeah, I agree.
And what's your diet like?
Diet's okay. It's I eat vegetables every day. Probably should have more, but
Yeah.
it's okay.
Do you use any drugs?
No,
Do you drink alcohol?
no,
Okay. Have you ever used any drugs?
no.
Okay.
No.
And do you have any pets?
No, we do not have pets.
Okay. Have you traveled outside the country recently? Gone anywhere fun or exotic?
What's recent? Like last year or something?
Yeah. Probably within about the time frame that this started to hurt.
Oh no, I haven't traveled out of the country.
Okay. Awesome. Well, I'm going to start the physical exam portion.
Okay.
But before I do, I just want to ask you: do you have any family history of any major diseases?
My dad has high blood pressure.
Okay.
Yeah.
Your dad and your grandparents, aunts and uncles?
Almost all my grandparents died of heart failure. So.
Okay. So we've got some heart disease in your family. What
Yeah.
about any diabetes?
Yes, diabetes. Both grandmas had diabetes.
Okay. High cholesterol,
Yeah.
cancer.
No cancer.
Okay. All right. And that's on both sides that you have that.
Yep.
Okay.
Yep.
Great. Well, like I said, I'm going to start the physical exam just to see, and what I'm doing is I'm feeling to see if there's any lumps or bumps or any noticeable abnormalities on your skin, and I'm also seeing if the temperature's all right in between. You want the temperature to be similar in between your legs and your feet.
Okay.
And so I'm just going to check both feet, even though I know you said that you only have that problem with your left foot. All right, everything looks really good. So I'm just gonna, what we're doing now, it's gonna feel like I'm pinching you, but really all I'm doing is just making sure that your skin has good elasticity and that it snaps back when I pinch it up like this.
Okay.
So now I'm just gonna feel some of your pulses, and both of your pulses on your feet will feel good. It's about a 2 out of 4, which is normal.
Okay.
And your toes feel a little bit cold, but I bet it's just because that's cold outside today.
Yeah, it is cold.
Reach up here behind your knee.
Okay.
Check the pulse up here. Okay. And on the other side. And have you ever had any swelling or anything here? I don't see any today.
No, it doesn't really swell up.
Okay.
I've never noticed anyways.
All right. Well, I'm going to have you scoot to the edge of the table.
Okay.
I'm going to use this hammer. I'm going to test some of your reflexes, okay?
Okay.
So, just relax. All right. Okay, and then down here by your ankle. Okay, that looks good. And then I'm going to pull out this. I'm going to ask you to close your eyes, okay? And you just tell me if you feel the vibration, okay?
Okay.
I'm just going to put this right here on your ankle. Close your eyes. Tell me when you feel the vibration.
No.
Okay, and then tell me when it stops.
No.
Okay. And then one more time.
No.
And stops.
No.
Great. All right. Now if I have you scoot back for me again.
Okay.
I've got this little line here. It's a little bit like fishing line, and what we use it for is just to test to see if you have sensation in all areas of your foot.
Okay.
So close your eyes, and when you feel it, then you tell me, okay?
Okay. No. 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 No.
Great. I'm gonna do the other foot.
No. 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 No.
Great. Everything looks good there. And I'm gonna see if you have good sharp and dull sensation on your feet.
Okay.
So it's the same type of thing where I'm gonna have you close your eyes, and you're gonna either feel this brush that's soft, and feels like this, okay?
Okay.
Or you're gonna feel a little bit of a sharp poke like this.
Okay.
Okay. And you just tell me soft or sharp.
Okay. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Sharp.
All right. That looks great. All right, now I'm just going to test your muscles. If you'll just push against my hands. All right. Great. And then what I'm going to do here, sometimes people have tight calves,
Mm-hmm.
and so I'm just going to see if you have normal movement in your ankle.
Okay.
All right. Looks like you're getting at least the 10 degrees. 10 degrees is normal there,
Okay.
so feels like, yeah. You're looking pretty good on that. So you got normal range of motion there.
Perfect.
All right.